Excellent. Sit back, please. Perfect. So, doctors, you'll keep seeing patients here, and I love to share their stories with you all the time. This is a patient who came with very advanced keratoconus. Your quick history, please.
Yep, I've been diagnosed with keratoconus around 12 years ago back in New Zealand. So I've been left, the only option I had was to wear hard contact lenses to play sports or to have a proper vision.
Cricket. You're a big in cricket.
Cricket is one of the main sports I play. Even badminton and things like that. If it's any fast-moving objects, basically.
Sure.
Yep. So I met Dr. Gilani. It's basically changed my life really. After a few surgeries, we went from almost a 20/20 vision from being almost blind.
Yes. Without glasses contact, correct. That's also
Yeah.
important because I keep teaching surgeons without glasses contact. Even if someone needs glasses contact, it's okay, but aim should be always freedom for you all, and that's what you are with your fast cricket. So doctors, very important, you all understand my structural and visual concepts, and I will draw that for you. Here he is in the left eye. We've done an intact technique with my differential titratable technique that you can see. You can see the ring right here, and that took the astigmatism from 4 diopters irregular astigmatism and 6 diopters astigmatism straight to 1.2 in the left eye. All right, that's the differential map right there. Right eye, we did laser plastique as usual. No evidence of surgery, no flaps, no cuts, minimal tissue removal, straight to 20/20. So right eye, left eye. So this left eye started as structural, and then we went into visual from there. The right eye was visual, we kept it at visual. So let's now draw it out for you and explain what this means. So to me, every patient who has keratoconus, which is your front cornea, correct, becomes like a cone, right? Your cornea has become like this. That's keratoconus. Now, I divide every keratoconus patient that comes to me, no matter from what country on this planet, into very simple 2 categories: structural and visual. Visual is when they can see with glasses or with refraction. Structural is when they cannot see with glasses or refraction. So structural patients come to us wearing hard contact lenses, scleral contact lenses, and there is no measurement on them. Visual can see. So visual patients, I do my visual surgeries on them, which are like ICL, laser plastique, premium lens implants, and even combination techniques. Structural, I do surgeries like intacts, corneal cross-linking. We do lamellar corneal grafts of different levels to rebuild their structures. Everyone clear here? Structural, you got to rebuild the foundation. Visual, they're ready for visual surgeries. Then structural, some of the cases actually become visual. Once they become visual, that in-between transition time is very important. The doctor has to dedicate a lot of time to measure them, remeasure them. Now, patients who come to me from abroad or from different countries, I make their doctors remeasure them repeatedly to show me 2 things: measurability and stability, right? Once they're measurable, great. And they also have to be stable because you don't want to chase the tail, right? You want to make sure they're stable to perform. How many times did I measure you, please?
Don't even remember, plenty of times. I had to come here so many. I was lucky to be here. And spent a lot of time on me to make sure I was right.
Doctor, that's very important because also you just cannot just do surgery without thinking. Surgeries are complex, but even the mathematics has to be very accurate. So please be involved. So not every structural patient becomes visual. Remember, this is a very important point. But you must fight as if every structural patient is going to become visual. Keep that mindset. Also, not every patient will see without glasses and contact. I've been blessed with numerous of my patients who are keratoconus, that to advanced keratoconus, see without glasses contacts, but that's never a guarantee to the patient or to anybody else. But as surgeons, we must aim for that outcome. All right? So here he again is another patient who's seeing 20/20 distance and near without glasses. And now he's 40, right?
Yep.
So even with the presbyopia he has, he doesn't need reading glasses. All that is important. And he still has his corneas. So structural patients may not necessarily become visual, but we should still strive for that. And when they do become visual, it's a great event. Like in his left eye, his cornea was structural, but he became visual after we did the unique titratable intact technique of mine. And then, because he became visual, we measured and we remembered, rechecked for stability, and then proceeded with laser plastique on top. Right eye, was already visual. So we went straight with laser plastic, and in his case, given how young he is, we also used cross-linking to our advantage and did that uniquely. So very important how you address these patients, and my surgical algorithm of always fighting for their best vision. So to summarize, keratoconus patient, no matter how severe you are, I break down into two simple categories, structural and visual. Visual are those who can see with glasses and refraction. Structural are those that cannot see with glasses and refraction, need hard contacts and scleral contacts. Visual, we do visually accurate surgeries like ICL, laser plastic, premium lens implants, etc. Structural, we do structural foundation surgeries like intacts, lamellar, corneal graft techniques, or cross-linking. And this structural sometimes can become visual cases, and that's amazing. Then we can go and do visual techniques for them. All right, so don't give up on keratoconus patients. Please fight for them. Every day I show you all patients here from all over the world. And always, as I say, the patients on camera are the highest accountability. Please give them visual freedom. Just diagnosing them and leaving them blind is not a treatment. Anything you want to say, Kanish? Does it make sense in your language?
Yeah, I mean, it's not just sport, right? Like just night driving, for example, it just changes your life. It's so much safer. And also small things like you're shaving, and when you're watching TV, you can watch the subtitles and all that. It makes a huge difference when you don't have to worry about. Thank you very much.
Enjoy yourself. Go out and get the world.